Hello, health champions. Welcome. Did you know that your skin, nails, even your breath could be revealing hidden clues about the health of your liver? Liver disease is far more common than most people realize. I see it every single day in the hospital, and often I can spot signs of liver disease the moment I walk into a patient's room. Today, I'm going to show you the top signs of liver disease so you know what to look out for. Take a look at your fingernails. They are constantly growing through a complicated, energy-intensive process. As a result, changes in your health often show up in your nails, and liver disease is no exception. See these horizontal white lines running across the nail? These are called Muirche's lines. These lines are actually on the tissue underneath the nail, not on the nail itself. If you apply pressure to the nail, they'll temporarily disappear. Since the lines are underneath the nail, as your nail grows, the line will stay in the same place. It won't grow out. Here's another nail finding called Terry's nails. Look how strikingly pale the nails are. Normally, your nails have a pinkish color because of the tiny blood vessels in the tissue underneath. But in liver disease, changes to that tissue make it harder to see the blood vessels, which is why the nails are so pale. If your nails look pale and you're wondering if you have Terry's nails, check for the lunula, the half moon at the base of the nail. Having a lunula is normal, so if you can see it, it's probably not Terry's nails. Both Muirche's lines and Terry's nails are linked to low levels of albumin, an important protein produced by the liver that's often quite low in liver disease. Next, try this test on yourself. Put your nails together. Can you see a diamond-shaped gap between the bases of your nails? If you can, that's normal. If not, and your nails look like they're curving around your fingertips, it's called clubbing. Clubbing is caused by the proliferation of connective tissue between the nail and the finger bone, making the fingertip thicker. It can be genetic, but if I see clubbing, I start looking for problems with the heart, lungs, or liver. Now take a look at this woman's belly. Your first thought might be that she's pregnant, but this is actually a very distended abdomen filled with fluid. This is called ascites. Shockingly, the abdomen can stretch and fill with up to 15 liters of fluid. This fluid builds up due to a condition called portal hypertension. When you eat, nutrients are absorbed into your bloodstream, and all the blood from your digestive tract is routed through the liver via the portal vein. In liver disease, scar tissue builds up and blocks the blood vessels in the liver, making it harder for blood to flow through. Like pinching a garden hose, pressure increases in the portal vein, causing fluid to leak into the abdominal cavity. This can be really uncomfortable and even make it hard to breathe. I often do a procedure called a paracentesis, where I insert a large needle into the abdomen and drain out the fluid. I remember during my residency I performed one and drained liters of fluid from a patient's abdomen. You can imagine the relief they felt. Portal hypertension doesn't just cause fluid buildup. It also reroutes blood through smaller veins not meant to handle the extra pressure. It's like Google Maps rerouting traffic through narrow back roads. One spot this occurs is around the belly button, where tiny veins expand and become visible under the skin in a twisted pattern. We call this caput medusae, named after Medusa's snake-covered head from mythology. The same thing can happen inside the body, especially in the esophagus. These enlarged veins, called varices, can rupture and bleed, and since people with liver disease have difficulty forming clots, this can be life-threatening. Anyone who works in an ER likely has a story about a variceal bleed. It's one of the most dangerous complications of liver disease. Now let's talk about palmar erythema, reddening of the palms, especially over the thenar and hypothenar eminences, sparing the center. This can be caused by liver disease or pregnancy. The link? Estrogen. The liver breaks down estrogen, but when it's not functioning properly, estrogen levels rise. One effect of estrogen is to dilate blood vessels. That's also what causes spider nevi, those small, spider-like blood vessels on the skin. Press on one, and it disappears temporarily. One or two are normal, but 3 or more may indicate elevated estrogen and potentially liver disease. Liver disease also leads to muscle wasting, which can be subtle. Check the palm of the hand or the temples where muscles are thin and close to the surface. Why does this happen? The liver processes nutrients, makes proteins, and stores energy. When it's damaged, the body breaks down muscle for energy instead. Another palm-related sign is Dupuytren's contracture. This is where the fascia in the palm thickens over time, leading to fingers that curl inward and can't fully extend, especially the 4th and 5th fingers. There's a strong genetic link, especially in people of Northern European descent, which is why it's nicknamed Viking disease. Try the tabletop test. Lay your hand flat on a table. If your palm can't touch the surface, it might be Dupuytren's contracture. Here's another easy test. Extend your arms straight out with wrists and fingers extended. In patients with liver disease, this can reveal a flapping tremor called asterixis. It happens when the brain temporarily stops sending signals to keep the hands steady, then quickly starts again, creating the flap. This shows the connection between liver and brain. The liver normally clears ammonia, a toxin created from protein breakdown. In liver disease, ammonia builds up, affecting brain function. This is called hepatic encephalopathy. One time in the ER, I assessed a patient found unresponsive. His vitals and blood sugar were normal, but he wouldn't wake up, even with a painful sternal rub. But I noticed a musty, sweet smell on his breath, which I immediately recognized as fetor hepaticus, Latin for foul odor of the liver. It's caused by toxins like dimethyl sulfide being exhaled. Blood tests revealed high ammonia levels. He hadn't had a bowel movement in days. Bacteria in the gut were breaking down protein and producing ammonia, which his liver couldn't clear. The treatment? A laxative called lactulose. It helps move things along and converts ammonia to a less absorbable form, ammonium. It's incredible to see how clearing the gut can restore someone from an unresponsive state. Let's go back to that video of asterixis. Did you notice her yellowish skin? That's jaundice. The liver processes and eliminates bilirubin, a yellow pigment from red blood cell breakdown. When the liver fails, bilirubin builds up in the blood, turning the skin and even the whites of the eyes yellow. Urine may also turn dark brown or tea-colored. Easy bruising and bleeding are also signs of liver disease. While the occasional bruise is normal, frequent or unusually large bruises that take a long time to fade can be worrisome. The liver produces clotting factors, proteins needed to stop bleeding. In liver disease, these decrease. The liver also produces a hormone called thrombopoietin that tells the bone marrow to make platelets. Fewer platelets mean more bruising, and if the spleen is enlarged, which often happens in liver disease, it can trap platelets, further worsening the issue. Sadly, there's no real cure for liver disease other than a liver transplant. That's why prevention is critical. The top preventable causes include alcohol, so it's important to minimize drinking. Metabolic syndrome, linked to obesity and diabetes, is the most common cause I see in hospitals today, and prevention involves maintaining a healthy weight. Chronic viral hepatitis, especially hepatitis B and C, also contributes. There's a vaccine for hepatitis B, and about 10 years ago, we developed a cure for hepatitis C, which has been a game changer. If you enjoy learning about signs of disease that you can see for yourself, check out the video on what your hands say about your health. If you found this video helpful, give it a thumbs up. Share it with your friends and family. And most importantly, subscribe to the channel for more simple health tips that make a big difference. And while you're at it, tap the notification bell so you never miss out on our latest content. Thanks for watching, and stay healthy and keep smiling.